Hi, today we're talking with Dr. Tom from Natranet. Our topic today is sinusitis. Now, Dr. Tom, sinusitis is a really prevalent problem. What is causing it to be such an overwhelming issue for people? And is there anything people can do other than taking antibiotics to help cure this?
Sinusitis is indeed seeming more and more prevalent. Of course, during the winter time and the fall seasons, depending on the part of the country the person lives in, there seems to be more of an increased incidence of that type of a thing. So very often, physiologically, we say, okay, so you have this inflammation/infection that's going on in your sinus, and the problem is how do we get anything in there to basically be able to heal it? Is there therapies that can be done other than antibiotics? And in fact, there should be other things that other than antibiotics, because it's become prevalent that more and more sinus infections, even from the Centers for Disease Control, are saying that the use of antibiotics willy-nilly is actually not good for people, because many of these, especially people who have had repeated sinus infections, it's rarely a bacterial type problem of which antibiotics may be helpful, but more often it's a fungal type problem. So the different type of medication and even anti-fungal medications may not be the most beneficial. So you have to really look at why the person gets it. So if they have a cold or a flu, there's other ways to treat it. Food sensitivities often play a big role in the whole aspect of people who are susceptible to sinusitis. There can be an anatomical type thing, so you can have people do a variety of different types of therapies using water, different at-home type therapies. And you're going to get really good results in the long-term aspect. And then you have to do preventive care. Just treating the sinus problem when you have the pressure in that may buy you a little bit of time, but many people, especially the chronic sinusitis, will have it in any one season 3 or 4 times. Mm-hmm. So just repeating taking a prescription is really not in the person's best interest, so they really are going to have to be looking at other approaches to manage that chronic problem.
Great. Thanks, Dr. Tom.
You're welcome.